You know, folks, we spend a lot of time talking about physical health, but mental health is just as important. The reality is, mental health disorders are more common than you might think. They affect millions of people from all walks of life. It's critical to understand these disorders, not just for yourself, but for your loved ones too. Knowledge is power, and the more we know, the better equipped we are to support ourselves and each other. In this video, we're going to break down some of the most common mental health disorders. We're going to talk about what they are, what to look for, and how to get help. Remember, there's absolutely no shame in seeking help. It's a sign of strength, not weakness. We're going to cover everything from depression to anxiety, bipolar disorder, schizophrenia, and more. We'll dive into the symptoms, the causes, and what you can do to move forward. So, let's get started. Let's talk about depression. This isn't just about having a bad day or feeling down. Depression is a serious condition that affects your mood, your thoughts, your behavior. You might feel hopeless, lose interest in things you used to enjoy, or have trouble sleeping. It can be a real struggle to get through the day. And listen, it's important to understand that depression isn't a sign of weakness. It doesn't mean you're not trying hard enough. It's a real medical condition, and just like any other health problem, it needs to be addressed. We'll talk more about getting help later, but remember, you don't have to go through this alone. Now, let's talk about anxiety disorders. We all feel anxious sometimes, but when those feelings are persistent and overwhelming, it could be a sign of an anxiety disorder. There are different types: generalized anxiety disorder, panic disorder, social anxiety disorder, and phobias, just to name a few. These disorders can manifest in different ways. You might feel restless, on edge, have difficulty concentrating, or experience physical symptoms like a racing heart or shortness of breath. The key is to recognize these signs and get help if you need it. Bipolar disorder is characterized by extreme shifts in mood, energy, and activity levels. Imagine going from feeling on top of the world to feeling completely drained and hopeless. That's the reality for people with bipolar disorder. These mood swings can be intense and disruptive to everyday life. It's not just about feeling happy one minute and sad the next. It's about experiencing extreme highs, which we call mania, and lows, which are depression that can last for days, weeks, or even months. Schizophrenia is often misunderstood. It's not about having a split personality, like some people think. Schizophrenia affects a person's ability to think, feel, and behave clearly. People with schizophrenia may experience hallucinations, which means seeing or hearing things that aren't real, delusions, which are false beliefs, and disorganized thinking. It's a complex disorder, and it's important to remember that people with schizophrenia are not dangerous. They need understanding and support, just like anyone else struggling with a mental health condition. Let's talk about OCD, or obsessive-compulsive disorder. OCD involves recurrent, unwanted thoughts, these are called obsessions, and repetitive behaviors or compulsions that a person feels driven to perform. These obsessions and compulsions can be incredibly time-consuming, and honestly, they can really interfere with daily life. For example, someone with OCD might have an obsession with germs and feel compelled to wash their hands constantly. It's important to remember that OCD is a treatable condition, and therapy can help people manage their symptoms effectively. Post-traumatic stress disorder, or PTSD, can develop after experiencing or witnessing a traumatic event. This could be anything from a car accident to military combat, sexual assault, or even a natural disaster. Symptoms of PTSD can include flashbacks, nightmares, avoidance of things that remind you of the trauma, and feeling emotionally numb. It's a normal reaction to an abnormal event, and it's crucial to seek professional help if you're struggling with PTSD. Eating disorders are serious mental illnesses that involve extreme emotions, attitudes, and behaviors surrounding food and weight. They can manifest in different ways. Anorexia nervosa, bulimia nervosa, and binge eating disorder are just a few examples. These disorders can have serious health consequences and affect a person's physical and emotional well-being. It's important to remember that eating disorders are not about vanity. They're often a way of coping with underlying emotional pain, and honestly, they require professional treatment. Look, we've covered a lot of ground today. We've talked about some tough stuff, but it's important to remember that you're not alone. Mental health disorders are common, and they're treatable. If you see yourself in any of these descriptions, or if you're worried about someone you love, please reach out for help. Talk to your doctor, a therapist, or a trusted friend or family member. There's no shame in asking for help. In fact, it's the bravest thing you can do. Remember, your mental health matters. It's just as important as your physical health. So take care of yourself, be kind to yourself, and don't hesitate to reach out for support when you need it. You deserve to live a happy and fulfilling life.